is Rachel. I'm going to be your nurse today, and we're going to change your central access dressing. And I'm going to start with some hand hygiene for 20 seconds for CVAD guidelines here. And I'm going to give us some privacy. And I'm going to be checking my environment, make sure it's safe. All my equipment is in working order. The bed height is appropriate. My patient is in the right position for this procedure. And I'm going to gather my supplies and check my MD orders and make sure I have everything ready to go. And I'm going to talk to my patient here, and I'm going to ask you, can I get your name and date of birth? Okay, great. And I'm checking the wristband. And do you have any allergies? They don't have any allergies. And I'm going to educate the patient about the procedure and answer any questions that they might have. Okay, I'm going to do some hand hygiene again. And I'm going to put on some clean gloves. And I'm going to put a mask on myself. And then I'm going to ask my patient to turn their head away from their central access device. I'm going to place a mask on them. Okay, and now I'm going to look at my my dressing here, my site, and I am going to feel. I'm looking for any swelling, tenderness, redness, drainage, all that good stuff, and I don't see any. And now I'm going to go ahead and take off my dressing, and I'm going to do this carefully. I don't have the correct dressing here, but if I did, I could pull it away. The goal here is to avoid migration of the catheter, so I'm going to do my best to be careful about that with the supplies I have. So I'm going to hold it. I'm going to hold it down. And I'm kind of hold it down here. Okay. And then I'm going to dispose of my dressing over here. And I am, again, taking a look. I'm taking a look at my access site here. And I'm looking for any redness. I'm looking for any tenderness, swelling, normal findings. And I don't see I'm going to be measuring the catheter, and I'm going to use that with the little nodules, the little notches that they have in it, and I'm going to compare that to the patient's electronic MR that I've checked previously to make sure that no migration has happened. And as I've measured and I'm measuring and looking at so I count my notches and I compare that, and no migration has been noted. And so no migration has been noted, and no migration has been noted. Okay, so now I'm going to dispose of my gloves. I'm going to dispose of my gloves, and I'm going to put that away properly. And now we're going to prepare for the sterile part of this procedure. And so I'm going to do some hand hygiene. And wash my hands per CDC guidelines. And then I'm going to open my sterile kit. So I have it right here, and I'm going to carefully dump it out. And then I'm going to go ahead and open the flap away from my body first, then the one towards me, then the side flaps. Be careful not to touch the inner contents. Okay, now I can go ahead and carefully place my bio patch that I'm going to do later on. So I have a package here, and I'm just going to be opening and touching the very, very edges, not touching the inner part of the package, and I'm going to be gently placing it in my sterile field. making sure that it lands within, not making sure that it doesn't land at the edge. Okay. So now I can go ahead and don my sterile gloves here, and I'm going to open my package. I'm going to grab my flaps. And not going within order. So now I'm going to go ahead and I'm grabbing under the cup, doing this sterilely. Okay, sterile technique has not been broken. I'm going to go ahead and grab the inner packet, and I'm going to put that in my biohazard bag here. So I have room. Now I can go ahead and arrange the supplies on in my kit right here so that I can have room to work. Okay. Okay, and I'm going to go ahead now, and I'm going to be cleaning my axis here. And first I'm going to open my package for my alcohol swab so it's ready to go. And I'm going to take my alcohol swab out of the pack, and I'm going to be cleaning in a circular motion around my axis site. I'm going to do that for 30 seconds. Okay? And okay, and 30 seconds has passed. Okay, and then I'm going to be really careful. And I'm not going to be going over my sterile field. I'm going to be going around it. I'm going around it to place. I'm going to dispose that properly, not crossing my sterile field. Now I can go ahead and use my ChlorPreps, and I want to go in a backward-forward motion. And I can press my little button, and my chlorhexidine will come out. So I'm going to go in a backward-forward motion. And I'm going to clean. I'm going to do that for 30 seconds too. Okay, I'm going around my sterile field. Then I'm going to grab my other CHG swab, and I'm going to be doing the external catheter line itself, going from the insertion site up. So I'm going to try to get this as clean as I can. Okay, so I've done that, and I'm going to go ahead and go around my sterile field, and I'm put it there. And now I can put my bio patch in, and I'm going to be really careful, and I'm going to put my bio patch on blue side up, okay, radial to the, okay, and now I'm going to put my transparent dressing on. Okay, so I am going to go ahead and place my transparent dressing down, and I'm going to kind of coil my line here. I'm being really careful that no migration is noted, so I'm grabbing my tape now. So sterile. So my sterile field has been broken now, and I'm going to go ahead and place that down on each side there. And I have I have a label here. I have a label already, and I'm going to put my label. I have a ready-made label, and I can put that down with my name, time, and date. My name, time, and date. With my name, time, and date. And I'm going to go ahead and place another piece of tape right here on my line. Go ahead and place another piece of tape here on my line. And once I've done that, then not forgetting that and then I'm going to go ahead and make sure that my patient is comfortable and they don't feel any pain. They don't need to use the restroom. They don't need anything. Their bed is low and locked. Their call light within reach. Their head raised. Everything's in working. Their equipment's in working order. And I'm going to thank them for the time. I'm going to take off my gloves, and I'm going to wash my hands. I'm going to wash my hands. Going to clean up my supplies, and go ahead and exit the room.